The next section we'll be talking about are the interdental stimulators, and they range from brushes to tips of all different sizes. What I'd like to say about these is that anytime that you're unable to floss, basically these are great options. I don't want it to be misconstrued that there is a substitute for flossing because the floss is important to keep the teeth healthy as well as the gums. But we do need to note that I'm a very practical dental hygienist in the sense that if you are not able to floss, you definitely need to be stimulating your gums in some other way. So these ways that we'll be talking about are becoming very, very important for you to learn because this could actually save your teeth, save your gums. The first is these interproximal brushes, and they're very fine, they're pointed. These are great for targeting specific areas such as the in-betweens of teeth, as I spoke of, which is where, if you're unable to floss, where you need a lot of that disruption. Also, the backs of third molars or second molars, first molars, whatever's last in the arch, you definitely can clean very effectively there. What's nice about the brushes, too, is that you'd be able to dip these in an antibacterial mouth rinse, and that, combined with this brush, is going to make that even more effective. So you can use this brush even to go right along the gum tissue of all the teeth in between, specific areas that or larger areas. These make a great stimulator for. Another great tool is the gum stimulator. And what that is, it's a little rubber tip that you used to find on just about all toothbrushes years and years ago. And now you can't seem to find a toothbrush with one. But what these are intended to do, they're intended to be like tracing devices. And which means is that they're plaque removers. They're tracing right along the gum line to get off and to disrupt that bacteria. And that in turn will keep that gum tissue healthy. So again, the rubber tip, it's still a very valid and good idea for plaque removal. And lastly, the proxy brushes. These are often recommended by periodontists, specialists who work with gum tissue. These are brushes that look like pipe cleaners. They come in varying widths, thicknesses, and sometimes even extra soft bristles. But they're terrific because they fill space, and you work these in between teeth, back and forth. What's nice about all of these is that these are adjuncts that can actually be used sometimes right by your TV.